Hello, good afternoon. My name is Salim Pizurica and I'm a CTO and co-founder of Waylay. And my talk today will be about remote patient monitoring and elderly care. Unfortunately, we have been all witnessing the calamity that COVID has given to us in a variety of different ways. But one of the most terrible aspects of COVID is the huge pressure on health workers to provide a proper and timely assistance to people who are in a dire need. And today I'll be talking about how technology can enable us to be better at giving that support to people who are in need. Now, as you know, my title of the talk is about remote patient monitoring. And what we mean by that is that we'll be here imagining a use case in which the medical devices can push data into a cloud, and this data being available in real time to all nurses and doctors in the same hospital. Having said that, the last thing we want is to overwhelm the staff with awful lot of data and visualizations. What we want to instead is to have the alarm notifications, with having them to take appropriate actions, understanding what are the problems that patients are getting into. In this particular talk, I'll be looking at one particular issue, which is about the sepsis, which is inflammatory response to infection and is the leading cause of inpatient mortality within the hospitals in the US. And some of the possible complications can include heart failure, abnormal blood clotting, kidney failure, respiratory failure, strokes, liver failure, and so forth. Now, as we start thinking about delegating, if you like, diagnostics to the machines, we have to really understand what kind of algorithms are actually we are dealing with. And in many cases, as we know, there is a lot of progress happening in AI and machine learning these days. One of the natural choices can be neural networks. Now, here I would like to just indicate one of the problems that we might have as we are dealing with this sort of the problems. In one of the cases, one of the universities tried to actually use different machine learning models, and they use it for the monitoring of the pneumonia patients to understand whether these people need to be taken care in the hospitals or rather sent at home. And even though neural networks really perform very well, after a while they realized that the algorithm was sending asthma patients home, while these were the people who would be the first one to be sent to the hospitals. So what they have realized after a while is that in real life, when the doctors see the asthma patient, they immediately send that patient to the hospital without even bothering to write these things down. And as this data was not in the data logs, the algorithm itself was concluding that asthma patients had no problem with pneumonia. That's actually the reason why it's very important when you start applying these things that we can check this at any moment in time. So in this example, as you know, in many diagnostic use cases, you would have all sorts of different symptoms, and you will have to deduct what kind of problem patient is dealing with. In case of the sepsis, there are a variety of different measurements, such as the core temperature, heart rate, respiratory rate, white blood cells, and so forth. And what we also see here is one of the examples of how we train doctors and nurses actually to understand and diagnose properly patients. There are even on websites calculators, so to speak, which allow people to be trained or rather also enter the values. And in this particular case, exactly the same example, we would provide some input arguments like a heart rate and temperature rate, and then try to navigate through this sort of tree to understand whether the patient's in a problem or not. Now, one of the easiest way to actually explain that to a machine or rather to human what kind of things we are doing is actually to implement that using decision trees, because these trees are very easy to visualize and it's also very easy for humans to interpret. On the other hand, something else is very interesting. As the number of measurements is increasing, these things are much harder actually to visualize and much harder to interpret. And let me try to explain what's the problem with that. Imagine that we just have two measurements, for instance, heart rate and blood pressure measurements, which can be out of range or within a range. We end up with 3 states, and only with 2 measurements, we end up with 31 branches. Now, if you have 6 of these measurements with only 2 outcomes, bad or good, we'll end up with 264 branches. And just for a reference, the number of atoms in the universe, it's about 280. So we see immediately how actually it's difficult to implement such algorithms and such diagnostics using decision trees. Now, the other problem that you also have is that it's impossible to basically describe the voting problem. What does it mean? It's that imagine that only 2 out of 4 problems are already enough for us to understand there is actually a typical big problem. You cannot express it with decision trees, nor you can express the time information that might be required to actually merge streams from different data sets and different devices. So then obviously the question is that, is there another way to implement such a diagnostic rules? And today I will actually show you how you can actually do that with our automation technology. So let me go back to directly to a demo and to actually try to present different ways to express the same problem. Here I have the same sepsis shock example where I can configure different measurements and actually also describe majority problem. And moreover, we can read out together through each of these decisions and measurements to understand what the next action we're going to be taking. For instance, we have a drop, we have the infection, we have a general condition problem, and if there is also hypertension, we would actually send a call to a particular nurse. So now we imagine that we have some data logs and measurements. We'd like to test that rule in reality. So what I'll be doing now, I will start pushing data, for instance, for patient, let's give him a name, Michael. And what we see now, we are pushing the data as if it was a device measuring his condition. What I will do next is that I will basically start here the automation. So let's say this was the patient Michael. And we'll start diagnosis and see immediately how the automation engine will feel about this data and what kind of problems we're already seeing by implementing these rules. So basically we see here there is a particular problem, there is SPP drop maybe, or there is a heart rate issue and so forth and so forth. And once we actually understand and start trusting this use case, we can try to apply that one for all patients in the hospital. In order to do that, I will demonstrate that with another example. Now imagine that I am a nurse in the hospital, and what I will do now is that I will be here sitting on the floor and have 3 patients, Pete, Steve, and Paul, which are actually being monitored. So I'm going back to my simulation, and what I'm doing already for some time, I'm pushing data for Steve, Paul, and Pete, and basically you can see on the graph as it was a medical device sending this data towards the cloud. So for instance, this is data for Paul. Now I can look at the data here and see there is no problem yet because I have not applied a rule yet in my environment. So let me go back here and now imagine that I'm happy with this rule and I would like to apply it to all patients. This is what I'm going to do now. So I will take the example I showed before and now link that to all patients on that floor. And the result of that, I will start automation and diagnostics for each of these patients separately. So I have now Steve, Pete, and Paul under monitoring. And if you look back here, I can see already there is a particular problem with this patient. If I go back now to my visualization, I see already they have 3 patients, and all of them deserve some attention, so to speak. I can actually look also to the visualization here and see how each of these patients is behaving. And what you see already, there is one patient, particularly Steve, who has actually even more problems than the others. Now, in order to actually simulate infection, I will also here simulate by pushing here measurements that Steve as well has infection. And as a result of that, I'm getting a call.
Shock for the patient Steve. I repeat alert sepsis shock for the patient Steve.
So now me as a nurse, I can actually go back here. I'm getting a call. I go back here and understand there is a Steve who is really in dire need. And I can go back to the doctor and actually deal with that emergency right away. So that was my short demo and demonstration of the remote patient monitoring. Should you like to know more, please go to our website or request a demo. Thank you very much and bye-bye.